Hello, my name is Helen O'Connor. I'm the Deputy Director for Infection Prevention and Control. I'd like to introduce the multidisciplinary team. We are all working together to improve patient safety and raise the standards of infection prevention and control across the whole organisation.
Hi, my name is Joy Brewer. I'm the microbiologist and infection control doctor.
My name's Louise Marvin. I'm the infection prevention and control nurse.
I'm Heidi Eagle. I'm an infection prevention and control nurse.
And my name's Emma Cram. I'm the antibiotic pharmacist.
We also have a healthcare assistant who's unable to be with us today, but she's extremely proactive and a cheerful disposition out on the wards every day. During the past year, the infection control nurses have been focusing on isolation practices throughout the trust and have revised the isolation policy in conjunction with the rest of the team. We are very pleased that during the last CQC visit that they noticed the fact that we use a different coloured apron when we close the bay or for patients inside rooms known or suspected of infections. We've seen the introduction of the peripheral venous catheter insertion pack, which we anticipate will assist in reducing blood-borne infections.
We very much try and work together as a team and try and make it an end-to-end process as much as possible. Since I've been here working with a very effective team, we've managed to introduce some really good measures over the last 6 months. A couple of things that I take special pride in is obviously being able to deliver a ward-based infection presence, which means reviewing patients every single day, responding both reactively to doctors and other professionals' requests, and at the same time proactively trying to manage infection.
Over the last year, the infection control nurses have divided up the wards basically into surgical and to medicine. Louise and I have taken medicine and surgical wards each, and we visit the wards each day reviewing all of our side room patients and all of our patients with diarrhoea. This has led to an increased presence on the wards and a 50% reduction in our C. diff cases. Whilst Louise and I are on the wards, we're doing some teaching in the clinical areas. We're also helping with the flow of beds and the flow of patients through the trust with prioritising side rooms, acting as role models and teaching aids on the ward for all clinical staff.
This year we have introduced a public information board in the main entrance area of the hospital, which provides visitors to the hospital with topics pertinent to the time of year, such as norovirus. This has been very well received.
So every year we are involved in European Antibiotic Awareness Week. It's a week-long campaign where the infection control nurses, the pharmacist and also the microbiologist gets involved, where we man a stall from main reception in the hospital, and it's about focusing education and promoting awareness about antibiotic resistance, focusing on educating the public. So we've introduced the antibiotic microsite and the smartphone app as well. So the antibiotic microsite contains all the information you need for dosing antibiotics. It has calculators on there as well. So that's just to make sure that doctors are prescribing antibiotics at the correct dose, choosing the correct antibiotics as well, to make sure that patients are safe and that their treatment is according to the guidelines. So we encourage all of our doctors, pharmacists and nurses as well to download our smartphone app, which contains all of the guidelines as well as other antibiotic related information, just to make sure that the patients are safe.